So these are our four keynote speakers. The first keynote will be delivered by Philippe Borremans, who is an emergency risk and crisis communication consultant. The second keynote will be delivered by Jan Jin, a professor of public relations at University of Georgia. The third keynote speaker is Mathew Seeger, professor of communication and dean of the College of Fine Performing and Communication Arts at Wayne State University in Detroit. And finally, we have Andreas Schwarz on the panel. He's the chair of the Department of Public Relations and Communication of Technology at Ilmenau University of Technology in Germany. And now it's Andreas' turn. He's going to present, Andreas Schwarz from Ilmenau University. He's going to present on internal risk and crisis communication on the COVID-19 pandemic, global experiences of higher education institutions. So that's an organizational perspective that is going to contribute, which I think is a very, very nice and worthwhile add to today's program. Andreas.
Yes, hello Florian. Can you see my screen and the presentation?
Yes, we can.
Very good. Okay, hello, welcome everybody. First of all, I would like to thank Florian, Audra, and Sylvia for the invitation to be on that panel and talk to you in the ECREA crisis communication section. And yeah, so this will be about a study that is basically currently ongoing. We are still in the middle of analyzing the data. It's a qualitative study, so a lot of text to read, especially interview transcripts, which I was doing still until shortly before that presentation. So it's really work in progress, and I have some preliminary results and especially preliminary conclusions for you here. It's all about understanding instructional risk and crisis communication messages created and distributed to internal publics at universities around the world during the COVID-19 pandemic. I'll get to more details in a minute. And we were also interested in understanding the communication skills and competencies that those university communicators actually have or apply across countries when they do risk communication on COVID-19 with their internal publics. And also we were asking for the challenges that they have faced in that situation that they are still facing right now. Yeah, so in terms of the relevance, we are trying to contribute with that study to the lack of cross-cultural risk and crisis communication research in general, but especially beyond the very much researched areas such as the United States or Europe, which Audra has shown very impressively in her literature study on the state of the art in risk and crisis communication. We also applied the idea model here and tested that model from an organizational perspective. So how much can it help us to understand message creation from this organizational or the communicator's perspective? And we will also try to deduce some lessons for best practices here, especially for universities. So that kind of organization that many of us are working for, actually. Yeah, so this was our guiding model, the idea model developed by Timothy Selnow and Diana Selnow and some other colleagues who have contributed to that research. It's a model that is mainly centered on, let's say, message creation when it comes to risk communication. So what elements should effective risk messages include in order to achieve the rather high degrees of protection motivation in a public that is at risk, for example, in a pandemic such as COVID-19. And the model argues that there are three very important elements that should be included and always combined in order to achieve the best results on protection motivation. So one is internalization, where you explain your public why it is affected and how, and you do that through explaining, showing compassion, explaining the personal relevance, how close it is to them in terms of proximity, etc. When it comes to explanation, it is about explaining what happened, why and when, by using credible sources, including accurate science, but also translating that science into a language that your audience understands. And third, it is action. It is communicating about what the potentially affected publics should do, how they should behave in order to protect themselves, but also what the responsible institutions are doing to protect them, for example. So it's about efficacy and self-efficacy. The fourth element is distribution, and it addresses the challenge of communication channels that should be used to reach the target audience to get the message across. And the model also argues that there should be an overlap of multiple channels delivering a consistent message, because it would raise credibility of that message and also increase protection motivation within the public at risk. So this is more or less the model that we applied. Obviously, the model has some overlaps with other well-known models in risk communication, such as the extended parallel process model and protection motivation theory. But that is a discussion for another platform, I think. But this was our guiding model. We used these dimensions to deduce questions that we asked our interviewees in that study. And I quickly want to introduce you and show you the persons who actually helped me in conducting the interviews. So we conducted that study in the context of a research module, a research seminar in our master program in Media and Communication Science at TU Ilmenau. So when the pandemic happened, on short notice, I asked my students if they would be interested in throwing our idea what to do in that module overboard and do a study on COVID-19 communication. They all agreed, and that was perfect for me as well, because my students come from basically all over the world. So we were able to conduct interviews in a lot of very different corners of the world. And our aim was to approach university communicators to see how they communicate with students, with staff, with professors and other internal publics. We also chose that object of analysis because students have an understanding of that environment and world and would be able to conduct the interviews, obviously. Yeah, and I also would like to thank my students to participate in that, conduct the interviews and deliver some of the data. For now, I saw Alberto in the audience. So hello, Alberto, and thank you for contributing to that study. So what we did is we conducted interviews with university communicators around the world. Here you see the countries that we included. For each country, we try to identify at least 2 universities, if possible, bigger universities, a public one and a private one, depending on the local education system, obviously, and in each university to address one of the main communicators that would be in charge of internal COVID-19 response and communication. So we were able to cover a lot of these countries, many countries around the world, and on most of the continents except Australia. But still the resulting sample was quite heterogeneous. So in total, we included 18 countries. However, I told you it's still work in progress. So far, we have been able to finalize the analysis of for 9 different countries, including 20 interviews who cover in total 17 universities, public and private universities. So the results that I can show you today, or some of the results, are from these countries: Canada, El Salvador, France, Germany, Bulgaria, Russia, Cameroon, Pakistan, and Vietnam. So so far, we tried to include some of the different corners of the world and to see if they are facing different kinds of challenges in their risk communication. This is the sample of interviewees that we included. So in most of the countries, we conducted 2 interviews. In France and Canada, 3 interviews. And you see, we have some heterogeneity in the sample, because in some countries like Canada, France, El Salvador, Russia, etc., we were able to convince some of the high-ranked communicators, like heads of the communication departments, etc., to take part in the study. In some other countries, we talked to employees or social media managers who were a little bit lower in the hierarchy. So obviously this can influence the results and the oversight that they have in general on risk communication in their institutions. Okay, so here are some of the results. First of all, what are the target audiences they mainly address, so that you understand what kind of people we were talking to and what kind of people they addressed in their risk communication. So basically we had quite some good overlap with internal publics here. So most of these communicators were addressing students, lecturers, researchers, professors, and their administrative staff internally. So we established a good, let's say, sampling equivalence across countries here. Some noteworthy differences are that, for example, in Bulgaria and Canada, they also addressed their alumni. In Canada, also, in addition to that, government and donors, which also matter, especially in contexts of private universities, for example. In Cameroon, they also addressed their cleaners, so the personnel and staff, that is basically cleaning the offices, but also sanitizing them, for example. Interesting was the case of El Salvador, the university we approached there, because they said our public has become everyone, because, and that was the description of the interviewee, the government was not doing such a great job in informing the public in the country about the pandemic and the things to do and the actual risk. So many experts from that university rose to become the national communicators and were like the most credible or one of the most used sources for the COVID-19 pandemic in the country. Some other universities also addressed prospective students, so high school students, for example, that might or would apply to their universities, but also parents of the students. And one interview in Pakistan especially addressed the needs of disabled people or people with disabilities that need special information and a special degree of empathy. And he mentioned that a lot of them are basically forgotten in the country. So they specifically addressed them in their university. So here are some preliminary results from our analysis of transcripts of these interviews. Here you see the measures are coding decisions per transcript. So they're basically just telling us or telling you how many coding decisions we made for each transcript on average per country on the different dimensions of the idea model: internalization, distribution, explanation, and action. And you can see that we did a lot of coding decisions for the distribution part, since, first of all, a lot of these interviewees focused very much on distribution, and they were able to name all their channels that they used. So this explains this high number of coding decisions. Not much was said or talked about internalization, for example, on the other hand. So how do you make it relevant to your public? How do you show compassion, etc.? So that was not such a big deal in the interviews as compared to other topics, such as tell them what to do, action, or where do you distribute your message? Now we go a little bit deeper into the internalization dimension, where we looked at several sub-dimensions, for example, compassion. So do these communicators at university show compassion and empathy with their publics internally? How do they address personal relevance? How do they show that there is some proximity to potentially affected publics? We address timeliness and ask them about the exemplification. So if they use certain exemplars, examples, pictures, videos, or something to make that message more convincing or more comprehensible. And as an outcome, we could see that, for example, the universities or interviewees in El Salvador, Pakistan, and Vietnam seemed to emphasize a lot on compassion and personal relevance. At least they had a lot to say about it, whereas others, like in Germany, for example, didn't talk too much about that. On the other hand, in Germany and Cameroon, but also Pakistan, a lot of exemplification was part of that process. Now, when we look a little bit more in the qualitative part of the analysis, here's the case of El Salvador for internalization. So they talked quite a bit about compassion, for example. So they were trying to use inspiring messages. They focused on families of the students or the professors, for example, and that they should do certain things to protect themselves, also to take into account their parents, their children, beyond themselves, for example. They also thought about psychological and mental illnesses and problems that students might have. So they started offering online courses on that to support students with their psychological issues. That was a big deal in that university for in El Salvador, for example. When it comes to personal relevance, there was a lot of insurance in the messages that they tried to apply. They tried to make it relevant, at least that's what they told us. And they were talking about the combination of rational and emotional elements in their messages, but especially the emotional part would be important, where they addressed family ties, ties with their loved ones, and the rational part would address more specific information about the spread of the virus. Also very much a topic relating to compassion was our interview in Pakistan, or interviews in Pakistan. It sounded a little bit more dramatic here. We want to keep them alive. We want to give them hope. We wanted to make them realize that life is not ended. So they did, for example, TV series and short videos to show people how they can manage this pandemic mentally, but also physically, because a lot of people would be in shock. And this is also the interview that where he talked about people with disabilities and that they have special needs and need special kinds of risk response and information. Yeah, and then they also try to do some more entertaining parts in order to support people at home, because they are basically locked in their homes, just moving between bathroom and bedroom. So they did some videos on kitchen activities and things like that to support their students, for example. Yeah, and also personal relevance was addressed here in a similar way, like in El Salvador, for example. Now, another example where internalization was not very important is Germany. So the interviews we conducted there basically showed us that at least these communicators didn't attribute a lot of importance to that. So they told us, yeah, the attention is already there. It's naturally there by the situation. We don't have to underline that in addition to that. So we didn't take any special measures here. And also they said, yeah, we didn't make that too explicit in terms of personal relevance. It's just based on the assumption, yeah, it's already there. They know it's relevant. And we found similar answers for our interviews in Canada, for example. So in some countries, internalization, compassion, etc., was not important in the crafting of messages and risk communication. Possibly a limitation in this in our practice. Now, when it comes to distribution, you can see there were a lot of coding decisions per transcript for the channels that were used by the communicators. Obviously, that is something that they could easily tell us. This explains the spikes in the coding decisions. For Russia, for example, our interviewer did not talk a lot about how they adapt their messages to the channels, and while the other interviewees did so and told us. And in general, they did not talk much about message coordination with other institutions, like with whom and how and why they coordinate messages in order to keep them consistent, for example. In many cases, there was simply no coordination happening. I mean, not much beyond taking over messages from the government or health ministries. In terms of the communication channels, the most used channels across countries, in most countries, were websites, emails, and Facebook. Only in Cameroon, they didn't use email because their students would not read emails anyways. And by the way, we heard a lot of side notes in the interviews that increasingly students are not reading their emails or missing their emails. This is why they, in addition to email, they have to use other channels, especially social media, to get to their students and inform them about ongoing problems, pandemics, and emergencies. Especially Facebook was considered to be very effective here. Interestingly, in two countries, especially Cameroon and Pakistan, WhatsApp was used very intensively, WhatsApp groups, and it was perceived as the most effective channel, since obviously students are using that channel very much and have it open all the time, so information gets across very easily and quickly. Also, interpersonal communication played a role. In 5 countries, personal communication was mentioned. In 4 countries, Zoom and video chat applications were mentioned. Traditional media play a role only in certain countries, such as local newspapers and radio. Radio, for example, was important in Cameroon, Canada, Pakistan, and Vietnam. In Cameroon and Vietnam and so on, but also Pakistan, it is important because a lot of students live in rural areas where there basically is no internet coverage or very weak internet coverage. So these channels are very important there. Yeah, message coordination with other institutions. I already mentioned that. It does not seem to happen too much, at least according to our interviewees. Most of them mention that they coordinate or take over messages from their health ministries. Some others mention the education ministries or the labor ministries. Apart from that, not too much coordination is going on. In some countries, they coordinate with other universities in order to keep the messages more or less consistent. For example, in Canada, they did that. And it was also mentioned, I think, in Vietnam. All right, now we come to explanation as another dimension in the idea model. Here we looked at credible sources, how much they would be used and cited, at accurate science as emphasized in their messages. Also important was intelligible translation, so how much is scientific information translated for layman persons or specific publics, and again, exemplification. And here we saw that, for example, in France and Germany, explanation played a minor role in crafting of messages compared to the other countries. At least the interviewees didn't talk too much about it. And overall, the topic of using accurate science was not very much talked about. So usually they mentioned that, yeah, we just take the information we get from our sources and transmit that to our publics. Usually the sources that would be used and are deemed to be credible were the World Health Organization, the national health authorities. In many universities, the local virologists and experts in their own university were used as sources and experts. In El Salvador, they also used mathematicians who developed models to explain the spread and further development of the pandemic. Only in Vietnam, official media and newspapers, so the state media basically were mentioned as sources as well. When it comes to translating your message to the public, especially scientific information, this was highly emphasized by our interviewees in Bulgaria, Cameroon, and Pakistan. It was very much downplayed by our interviewees in Canada, France, and Germany, who would argue that, yeah, we are getting good information from our ministries and the government. We don't need to do much translation here. And also, here's an example of that. For example, our Canadian interviewees argued, yeah, our students are quite intelligent. They can handle scientific information, so we do not have to edit that. Or we link to other experts who can take over the challenge. Now, when it comes to
Andreas,
yes,
this is also the gentle reminder that you can please come to an end soon.
Okay, I will hurry.
Thanks a lot. Okay.
final dimension of the idea model is action. There was broad consensus across all countries. They all communicated the same actions and behaviors: wash hands, wear masks, social distancing, etc. In Bulgaria, Canada, and Germany, they emphasized that it's important to make clear to those students it's voluntary. Yeah? This is our recommendation. Do it if you want. Yeah? We don't force you. Because they think it's important, because if you try to force them, it will create reactance or reluctance of students to adapt to these measures. Okay, then very shortly to the competencies for risk and crisis communication. So how skillful and competent or educated are these communicators to conduct risk and crisis communication? 11 out of 20 of our interviewees had a formal degree in communication or something related to that. And then the situation gets very sad. When it comes to books on risk and crisis communication, we had one interviewee who looked at a book or several books by Grunig, Coombs, and Parsons. In terms of models and theories of risk and crisis communication, the situation is also not very promising from our perspective of scholars. So one said they work with two-step flow theory, information communication models were mentioned, and basically the others said, yeah, we didn't have time, theory doesn't help us in practice, in the future we should look it up, or simply no. All of them told us, yeah, we rely on personal experience. I've worked in communication. I do that by intuition. I worked 10 years in communication. It is a trial and error approach, etc. So experience or lower degrees of professionalism are still dominating here in the field. Courses and trainings were almost not attended in any case. Only one, the communicator in Pakistan, mentioned that they used the WHO risk communication guidelines. That was an interesting single case here. Okay, I have to skip, unfortunately, the challenges and negative reactions. There were cases of misinformation. There was backlash among the students. There were cases in El Salvador where students were attacked that would be willing to be testimonials for the university communicators. And there was a lot of struggle about tuition fees because a lot of students asked for lowering or cutting the tuition fees because classes were not taking place or just online. Okay, conclusions. We found the idea model useful to study message creations at these organizations. So it is a good basis to have these conversations and understand how this process works. Most dimensions seem to be relevant for these communicators, although not really consciously or systematically. Not so much they emphasize internalization and in some cases explanation. Overall, we discovered a very low competence for risk and crisis communication compared to the knowledge that is out there that probably should be used to some extent. We also conclude for now that most of our theories in risk communication do not really cover multi-level crises because COVID-19 showed us there is not only a health crisis, there is a socio-economic crisis, there's a political crisis, there is a racism crisis, and many other things. And these models are simply not able to cover that and do not tell us how to deal with communication in that situation. These theories are still low in scope. They are low range. They're either message-centered or they are process-centered or something like that, but they don't bring it together. And this is something we urgently need to develop in the future. And unfortunately, I don't have time to explain you that, but what we basically need is a model that is able to combine the different factors on the organizational and institutional level with the level of perception, communication, and messages. And we know a lot of the variables in our different models and theories, we just have not brought them together. And I think this will be our main task in the future in order to be better prepared for pandemics like COVID-19. Also, the conflicts of interests among publics when it comes to multi-level crisis is something we urgently have to take into account and study. Okay, that's it. I would like to thank you for your attention. And also I would like to thank again my students who helped conducting all these interviews.
If you enjoyed the video and would like to see more, hit the subscribe button. Follow us on our social media and stay tuned.